Morning, good evening, good afternoon. I'm glad to be here. Thank you for the privilege to present at this wonderful conference of EQUINET, Reimagining Resources for Health. My name is Danny Gotto, and I'm the Executive Director of Innovations for Development. I'm going to present to you a paper that we wrote, a research study that we did, examining development assistance for health and its role in sustaining health inequities. This research study was part of our project, which looked at examining colonial legacies in development assistance for health and the impact this has created on health sector financing. We based on the understanding of the problem that we continue to see that aid is increasing, or has been as at least going on, coming in, but inequities and inequalities in health have persisted, and they, come with different dimensions of history, gender, regional and ethnic perspectives throughout across the country. For example, when you look at poverty and malaria, on the right is the distribution of poverty, child poverty, and then poverty per capita. You can see if you compare with malaria, you can superimpose malaria endemicity onto the poverty. Areas that are poor are highly having high incidences of malaria, prevalence of malaria. So the study had a methodology where we reviewed literature through secondary data, actually, analyzing government, donor, agency reports, and so many other data sources that were relevant. We also conducted key informant interviews and a validation workshop where we engaged key sector experts to further digest the information that we had gathered. We, of course, our intention was to question the aid and how it manifests and who it focuses on and where and how in terms of geography and the like. So the findings revealed that aid is increasing for the last couple of years, about 10, 15 years. Uganda has been a very good recipient of aid. However, as that is happening, the health sector is continuing to have deficit, budgetary deficit, as allocation of government has not really significantly changed. Actually, it has nearly remained constant. So that is something to ponder about. As aid is coming in, government is not changing its investment. So the shortfall has remained. We are, from the data, we see that there are several bilateral agencies and multilateral agencies, but on the bilateral agencies, it is primarily the US government and the United Kingdom government, and also many other European countries. And the focus is majorly health and the humanitarian space for the last 3 years, if you look back, 2018 to 2020. And also other areas like food and agriculture. Now, if you look critically here, you'll see other elements of social determinants of health, education, water and sanitation, social services, really receiving less as compared to health and the humanitarian assistance. That is very critical as an issue of equity. We are seeing that much of the aid coming in is primarily off budget, Actually, the current health expenditure of 41% from the aid space, only 21 is coming to the budget, national budget. And actually, when it comes, it is primarily focusing on procurement of HIV commodities. So the domestic and private health expenditure as a percentage of current health expenditure is 41. And much of it is out of pocket, and people are paying for malaria, NCDs, and some other non-infectious diseases. On the part of government only gives 17.2% of the current health expenditure, and much of it is wages and a little bit of capital development. So aid that is coming in, both for the budget support and off-budget support, is primarily focusing on HIV. So that is very critical in terms of the resources that leak out of the healthcare system, because as aid fails to invest in systems, there are loopholes. When we examine, for instance, several donors, but for this presentation I've highlighted USAID, we found out that there were a lot of inconsistencies in aid distribution geographically and the disease of focus. Of course, I've mentioned aid tends to cherry pick, and for the Americans, much of it is focusing on HIV. And UNICEF did a study in 2019 when they realized that of about 5 districts in the country had HIV cases, but they did not have any investment from the Americans, from USAID. So that is really a form of inequity there, that people have HIV, and MACU government is really not investing in HIV because, of course, struggling with the illusion that the Americans are taking care of it. So we are seeing that neglected diseases, tropical diseases, especially non-communicable diseases, mental health, really suffering, and the people in there, especially those that are poor, are really doing badly when you look at the statistics on mental health and NCDs amongst the poor. So the aid is really also creating an illusion that government can borrow. After all, somebody else is looking at the bills. From the key informant interviews, somebody made a comment and said that aid tends to create a very high appetite for loans, for people to really try to, of course, development financing. And this has created a very high debt burden. 54.4% of the current debt burden, debt to GDP, is primarily the external debt loans. So to further look also into other aspects that aid has, created or distorted and created inequities, is the fact that it is short-term. It doesn't completely address the issues. It's mostly not accountable to communities. It's not sustainable. It is top-down. Participation of communities is very low. And of course, the evaluation bias tends to praise itself. So what are we doing? We are trying to work around shifting power, processes, and funds by ensuring that we deconstruct and dismantle the powers within aid, build local agency and capacity, ensure that the process is efficient and funding gets to the people. How are we doing it? We're building a coalition, local coalition, which is an assembly of local actors, CSOs, local NGOs, CBOs, all brought together, and we work to support them to come up with a broader understanding, but also getting to see that they work together. We build their capacity, we make them investment ready, and we try to work around convincing partners to work through them. because we believe that ownership is about working with those who are in proximity with the problem. They understand it better, and they are able to influence change. I would look forward to further converse around how the local coalition plays in terms of creating an enabling environment, but also investing in addressing inequities. I want to thank you.
Hello, welcome to the EQUINET Conference 2022. My name is Gramsen from Innovation for Development, Uganda. I'm going to present to you one of the projects we are carrying out in the communities to tackle indoor air pollution. Indoor air pollution refers to the quality of air within or around buildings and structures, especially relating to the health and the comfort around of the occupants of these buildings. Indoor air pollution is attributed to the burning of unclean fuels like firewood, charcoal that release large amounts of hazardous pollutants into the air. But this is not what limits what the causes of air pollution within homes. It can also be dust or other materials or things that we use that emit particulate matter or fumes from them. The WHO estimates that 7 million people die prematurely every year due to air pollution causes. But when you look at the out of the 7 million, 3.8 million people die each year due to household exposure to smoke or from dirty cook stoves and fuels. In Uganda, it is estimated that 63% of the children that die due to acute lower respiratory infections are attributed to household pollution. But this doesn't stop to only children. When you look at the death of lung cancer, 7% of people that die every year due to lung cancer, 7% of these are attributed to air pollution. The same was 21% of people who die of pneumonia, be children or adults, 21% of them, it's attributed as the underlying cause of being air pollution. 20% of people who die of stroke, they can be attributed to air pollution. So after we have seen the challenge that air pollution and the threat it causes, all it puts to the world and the health of the people. I4DEV, with funding from AstraZeneca Young Health Program, is implementing a project within the sub-county of Zirobwe district in central Uganda, titled Integrated Indoor Air Pollution, Air Quality Improvement. The objectives of the project we're looking at reducing household air pollution through provision of high-quality solar energy cooking technologies to reduce the pollution that is being emitted through the inefficient cooking technologies or burning of insufficient fuels like firewood and charcoal. We're also looking at creating awareness within these communities by training young people about the linkage between NCDs, air pollution, but also the technologies that they're using for cooking. We're also looking at increasing their involvement in promoting the use of sufficient technologies, where the youth themselves, they can be advocates for change. We're also looking at improving the economic and social well-being of the young people, mostly aged between 10 to 24. Why we are focusing on young people? Because there is a rapid rise of the incidences and prevalence of NCDs of people nowadays. And then young people can be leaders of change for health behavior change. And if you look at a population like in Uganda, where you have more than 50% of the population being young people, it will be very important to focus such projects that aim at improving health within young people, as they are also the leaders of tomorrow. How we are doing it, we have identified 50 youth entrepreneurs within this community, who are being trained on how NCDs are related to efficient cooking technologies, but also they're being trained on how to make locally these technologies that are more efficient and less polluting within the very communities. Like you can see in the picture, that was a training by Yoga World Clean Energy, training young people on how to make fireless cookers within their communities and using just locally viable materials. How we are also promoting already made technologies. So we created a demo space within the community of Sirowe, and we displayed this, we showcase the different technologies that people come and learn about them. The criteria we used affordability. That's one thing, because we're dealing with a low-income community. And we looked also at the ability for these technologies to be locally replicated, and then the ability to reduce indoor air pollution, because it's the main factor that the project is looking at. Now, as you can see, a lady in the picture, she was cooking beans using a parabolic solar stove for a small business display center. Then we're looking also, we have technologies like the solar box and the solar dryer. All these, they're using solar technology and there is no emission of smoke. So, which means they totally reduce air pollution. On the other side, there is a stove, which is a solar-powered stove. It uses volcanic stones in replacement for charcoal, which means it also reduces fresh air pollution. Besides the project, yes, we have seen that we have addressed and we are promoting the use of these clean technologies, but that's not the end of air pollution. What needs to be done to address air pollution? There is need to increase the public awareness on air pollution, because most people are living in polluted areas, but without even knowing that they are living in polluted areas. So there is need for all actors, with government, civil society, academia, to come and try to create awareness within the communities, so that people know that this is a problem that we are living with, and this is how we can act to make a better environment for ourselves. Then there's a need to increase access and affordability to efficient energy sources, because most of the energy sources, the efficient sources of energy that can be used and are less polluting, they're expensive for most of the people in our communities, and they really can't afford them. So there's need to increase their access, but also the affordability. Government should reduce the taxes on such technologies. There's also need to address the underlying factors or influencers to household air pollution. Rather than only looking at the cooking technologies, we need to look at things like housing, we need to look at things like poverty, because they're also contributors to air pollution within communities. Then there's need to do more research and innovation, because however much we can say that there is air pollution, some people need to see that there is data about air pollution. So this is a call up for most academia, civil society, and all institutions involved in research to do more research, to put out this evidence even for our policymakers, so that when you go and you tell them that this place is polluted, maybe Zimbabwe has a challenge and the problem of indoor air pollution, there's evidence to show, and there's need to change. When you tell them that reduce taxes on these technologies, so that people can afford them and reduce the pollution exposure that they get, there is evidence and data to show that this is really a problem and we need to act. Then innovations that are also aimed at reducing air pollution within communities need to be done, and emphasis to this. Even this comes to even the funders and donors and everyone within the health space to come up, health environment, to come up with innovations that reduce air pollution within communities. I'll leave you with a quote from Bob Seale. He says, the only solution to air pollution is the people's human revolution. Thank you for listening to me, and a good day to you all.
Hello, my name is Joviah Gonza from Uganda. I work with Innovations for Development as an advocacy officer, and I'm going to be presenting on confronting inequities in the aid sector in health in Uganda. So Uganda highly depends on aid and receives large sums of it from in the form of grants, loans, and budget support from bilateral and multilateral donors and from global health initiatives. But although dependency on aid has increased over the years, Uganda continues to face huge financing gaps in the health sector, which is one of the most funded sectors. Now, given the high returns on health investment, external funding and borrowing to finance aid would not have been bad if what it does is designed and driven by the country, and if there is honesty and money is neither stolen nor misused, and if it complements and does not entirely substitute the role of the government, which is domestic financing, but this is not the case in Uganda. And so here I present some of the barriers to sustainable development in health in Uganda. One of these are power imbalances amongst actors or stakeholders. And in these power imbalances, the funder dictates to the recipient, in this case Uganda, what should be done with the funding and how it should be used. If it is research, usually the funder dictates the research agenda. And this risks ignoring local expertise and knowledge and capacities, and the fact that there is no direct access to funding reduces the empowerment of local communities to take part in solving the problems that affect them. It also encourages racist assumptions and attitudes. There is also a failure to recognize historical realities which result in inequities. For example, the failure to recognize or to acknowledge the fact that colonial projects were corrupt and extractive and left Africans or local communities poor. Now, aid comes into, one of the aims of aid is to reduce poverty, but there is a lot more to poverty than the lack of acceptable material possessions. And there is a need for funders to recognize that in order to truly bring about sustainable development in local communities. There's also a shift in official development assistance from grants to loans, which has left Uganda in huge debt burdens. These debt burdens cannot be serviced by Uganda because Uganda keeps borrowing from external funders to service these debts, and this means that Uganda will be kept in a cycle of borrowing in order to service the debt, a debt which shall never be entirely serviced. Lastly, I want to talk about internal weaknesses, such as the lack of institutional capacity, for example, in the form of human resources, technical skills, and advocacy funds to engage in things such as accountability of aid, especially for the civil society. And also there is corruption and the misuse of funds and resources, which results in a failure to implement entirely what is meant to be implemented, and therefore translating into failure to achieve sustainable development. Among the things that I think should be done to bring about sustainable development and to address the inequities in aid is taking advantage of local initiatives, such as the Kampala Initiative, which brings together very many organizations, civil society, and individuals that are interested in critiquing aid and addressing the inequities that come with aid to ensure sustainable development. Through local initiatives, we can build solidarity for Africans, and through these initiatives, local voices can be raised on what should be done or how aid is affecting and not doing what it is meant to do. These initiatives, yes, and also there is need for true long-term partnerships and stronger collaborations. In these partnerships, there is need to document what the donors should do to support and work in solidarity with local organizations. And documentation should not stop at that, but should also be translated into practice. There's also need for negotiations at all steps of the partnership. For example, negotiations on how much funding goes to who, how to advocate for more equitable partnerships. Also, there is a need to document the goals of these partnerships. For example, there must be details on how Africans want to engage, how they want to solve their problems, and it is essential that external funders respect and work hand in hand with Africans to ensure this development. There's also a need to empower African and local institutions. Empowerment can be done by centering local researchers. And in centering local researchers, there is need to recognize them, acknowledge them for their work. If there are publications being made, Africans should, if an African is the first author, then they should be presented as the first author and not just in between a number of authors who have not actually done work, but because they have funded, are being put as first authors. There's also a need to fund community-led versus community-based interventions. Usually, or most of the times, international NGOs set up in local communities and make implementation of projects and initiatives without consulting or without necessarily putting the community in charge of these projects. I think it is essential to put communities in charge of these projects, because by owning these projects, then they can come up with solutions to what is actually affecting them and hence contribute to the sustainable development that we all want. There's also a need for aid accountability, whereby not only recipients should be accountable to funders, but funders as well should be transparent in sharing the information that comes along with this funding, in sharing the terms and goals, and they should be trustworthy to ensure that what has been allocated to a community is actually being given to ensure that initiatives and projects are implemented. Regarding aid accountability, there is need to increase access to data and information on aid, which is what I talked about, sharing whatever there is on this funding and what it is meant to do. Lastly, there is a need for Africans to examine themselves on how they have been promoters of coloniality, how have we contributed to corruption, how have we contributed to misuse of funds that would have been used to bring about development in local communities. Lastly, I speak on the role of civil society, which would include evidence generation, to inform themselves and also the public of what the funding or what the aid has come in to do, what it intends to do. And this would also help in tracking the purpose of the aid to ensure that it is executed as planned. Thank you very much. I end my presentation here.